Hi, I'll be with you in a minute. Please take a seat. Okay. You're here for a routine cranial nerve exam? Okay, it's for a job application. They are requesting a cranial nerve exam. That's odd. Have you had an accident or do you had a concussion in the past few weeks or something that might worry your potential employers? Okay, they just want to know that everything's okay. Okay, very well. So you haven't had any issues with hits in your head, car accidents, sport accidents, falls? Not that you know of? Okay, good. Well, let's start by checking your scalp for any bumps or cuts, okay? Sometimes concussions can happen and we don't even notice because it doesn't hurt. Very rare, but it can happen. I have had a patient that bumped his heads to the headboard of their bed and they got a concussion. Mild, but they got it. Yeah, all bodies are different. Let me just check here. I do feel something odd. No, probably it's just the shape of your head. Oh, it's nothing. Let's see here. No, it's definitely how your head is shaped here. Good, that's good. So I'm guessing that you require medical. Oh yeah, okay, you're gonna have it. Let me just write this down. So yeah, a medical certificate that your cranial nerve exam is. Okay, so no head bumps or injuries present in the skull area. Good. Very well. Let's check your eyes. Okay. Good reaction. Looks nice. Good. Okay, so let's look straight forward. We're going to be focusing in this area of my face, on my nose. Okay? Try to follow the light just with your eyes, okay? Okay. Good. 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 Very good. Excellent. Now, have you had any eye exam in the past 2 weeks? Okay. Good. Very good. Let me know the moment that you can see the light, okay? Very good. Okay, good. Let's just cover one of your eyes here. Let me know the moment that you see the light. Okay. Okay. Good. Let's do the other eye. Ready? Good. 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 Your eyes seem perfect shape. I I just see here in your medical history that you had an examination for facial nerves. Yeah? How'd that go? Okay. Very well. So let's take a peek into your ears. Very good. Okay. A little bit of earwax here. Oh, okay. I see. You have been diagnosed with overproduction of earwax. So it's chronic. Yeah, I do see here. Yeah, I'm thinking that you're due to a new cleanup, but I don't see anything other than the overproduction here. Okay, let's take a little peek here. Very good. Excellent. Well, your ears are filled up with earwax, but I'm guessing that is normal for you with your condition, right? They haven't found a solution for it. Yeah, I bet it's something difficult. I had a couple of clients with an issue like yours, not as chronic as yours, but it is difficult to treat. Well, ears seem good other than the overproduction, but I'm guessing your employer already knows about this. Okay, so you already had your facial nerves tested. We're just gonna do the routine ones for your certificate, okay? Very well. So I'm just gonna ask you to do a few faces for me. You're gonna raise your eyebrows as high as possible. Okay, good. Now frown like you're very, very angry. Okay, now give me a big smile. Very, very wide. Okay, now to just one side, like this. Now to the other one. Yeah, as big as you can. Okay, now I'm gonna position my finger here. Now try to raise your eyebrows. Okay, fight it, fight it, fight it, and good. Let's release. Now I'm gonna pinch your face here. Good. Now try to smile. Big and wide. Try to fight it, fight it. Good, thank you. Now you're gonna close your eyes. I'm gonna be poking you. It's not gonna hurt, but I want you to let me know where I'm touching you, okay? Good. Forehead. Cheeks. Cheeks. Nose. Chin. Good. Lips. Okay. Forehead. Very good. Now again with eyes closed, I'm going to try to write a letter in your forehead. Let me know if you can sense what I'm doing. A circle or an O. Okay, good. Now on your cheek. An U. Good. Okay, good. An I or an L. Excellent. Facial nerve seems fantastic. No issues whatsoever there. Let's check your nose. Okay. Okay, now I'm gonna look up. Good. Okay, looks clear. That's coloration. Looks quite nice. Sinuses seem clear. Okay, I'm going to be pressing this area of your sinus. Can you feel that? Does it hurt when I press? Not really? Okay, good. Now let's do the aroma testing. These are pretty easy to distinguish, okay? Let's go with the first one. Applying into a cotton swab here. Do you have any food allergies, such as peanuts or shrimp? I'm not gonna give you shrimp, but sometimes it's good to know. Okay, good. Very good. Let's go with the first one. Chocolate. Good. Very good. Let's go with the next one. Kind of minty. Very good. And the last one. More like vanilla. Okay, good. Yeah, we are only worried that you don't smell like metal kind of stuff. Yeah, some people can't stand chocolate, so sometimes they cannot recognize the aroma. But as long as it doesn't smell metal-y, it's good. Let's shake your taste buds. Okay. Okay, we are good. Open wide. Good. Okay. Looks good. Very good. You can close it. I don't find anything wrong there. Now, do you prefer sweet taste, stinky, salty, anything like that? No preferences? Okay, just to make sure. Some people can't stand vanilla or can't stand mint. I just want to know, okay? Good, good. Very well. Now these cotton swabs are infused with several taste syrups. Just want you to suck on them. They're not pretty nice. Okay. Let's go with the first one. Okay. You can try it there. You have a bin on their side. Vanilla. Okay. That's good. Let's go with the next one. Okay. There we go. Like mouthwash. Yeah, kind of minty. Very good, thank you. You have on your side a cup of water in case you want to wash out your mouth. I'm sorry. You can drink it or you can spit it. You have a bowl right there. Okay. Anything you want. Okay. Good. Okay, let's see. You know what? I think we're gonna have to do another one. I see here. I don't know. Your job require more information about your site. I did notice that everything is good there, but they want me to be very thorough with it. Oh, for pilots. Yeah. Yeah, they're a bit picky for that, and I'm glad they are. Just do one final testing with that. Just look for some cataracts there. You're gonna be looking up. Don't mind me, I'm just gonna be moving around here. Okay. Just like that. Okay, good. Alright, you're gonna be looking to the side, please. Don't worry, you don't need to look to the light. Just wanna see how is the reaction of your pupils here. That looks well. Now to the side, please. Very good, just like that. Excellent. Good, good, good. Yeah, I think there's no further action examination that needs to be done. Your eyes are in perfect shape. I see that you had a visual examination and it went well. The eye nerves are completely well too. No point to just go further with that. You already had your eye examination and everything seems well. They just were worried about maybe a head injury because of an examination that they did, but I don't really find no signs of problems, nothing. Actually, you're in pretty good health, which is great. This is just a routine cranial nerve exam, so nothing serious to really note here in your medical certificate for your employer. So I'm happy to say that you have passed with A+++. Yeah, you were all right. Now let's just finish up your certificate here. Do you know if you're gonna be taking more testings? Okay, some skin testing. Okay. So I'm thinking I'm gonna be sending you to the next room, which is gonna be to your left, and they're gonna help you there. Okay, so I'm just gonna need you to take a look into this. This is your whole cranial nerve exam. Says it was a routine examination, that everything went well. No issues with your eyes, which was the main reason they sent you to us here. All your cranials were great, no nerve damage present, no bumps or hurts on your scalp, which was something that they were outbeat requiring on your employer sheet, but everything went well. So I'm just gonna need your signature right there. Okay, good, and my signature here. I don't know if there's anything else I can do for you today. No, everything went well. The only thing that they were worried about were your eyes, but I guess for your line of work it's very important. But no, everything went completely well, and I will say that you're in perfect health and ready to take action on any job that you may be applying to. Okay, so I'm gonna set this with my assistant. It should be ready in 15 minutes, and they're gonna give you the original too, a copy, and the transcript for your employer. Okay, very well. It was a pleasure. Please take care, and if you need anything else, please here with our receptionist. Thank you so much. Goodbye. Okay. Good. Hi, I will be with you in a minute. Please take a seat. Hello, I'm Dr. Whispers. Okay, you're here for your ear exam. Is there anything going on at the moment, or is it just a yearly checkup? Just a regular checkup. Very good. Okay. I see that you've been having issues with your ears in the past, along with some skin dryness, which is quite persistent and even chronic. You've been getting that treated with a dermatologist. Okay, that's good. How about your ears? Okay, you're also going with a specialist. That's great. When was the last time that you had medical issues, such as flu, maybe COVID, anything like that? Okay, thank you. Very well. So let's start by doing your checkup. At the moment, are you feeling any discomfort, pain, migraines? You haven't been able to sleep lately? Okay. Have there been any changes in your routine? Maybe you're eating a little bit later, or drinking too much caffeine. How about stress? Are you under a lot of stress lately? Any kind of stress isn't normal, to be honest, but I get what you say. Let's check your blood pressure. We're going to put your hand inside here, please. Okay, good. Might be feeling a little bit tight. Here we go. It's going to press. That's good. Okay, let's try to relax. Very good. Okay, you're in normal levels. Let's check your heart and your breathing. Okay, we're going to take a deep breath in. Breathing. Good. Now let's cough a little bit. Okay, good. Now the other side. Deep breath in. Good. Good. Okay, now we're going to cough. Very good. Let's check your heart. Very good. I'm going to place it here. It might be a bit cold. Very good. Are you nervous right now? The stress you weren't telling me. Okay. Yeah, it's a bit higher the number, but not that big of a deal if you're been suffering from insomnia and are also under stress. So okay, I'm gonna check your body temperature. Gonna press it in your ear. Okay. There we go. Okay, temperature is normal. Now, I am a bit concerned about your heart rate, so we're gonna be doing another test in a moment. I'm just gonna ask you to relax a bit, try to do an exercise of breathe in and breathe out. Are you in crisis at the moment? Do you have a moment in your life that it's too strong, that is making all these changes in your body? Okay, your blood pressure looks normal, but it's higher than your normal, which is pointing us that the stress levels in you is way higher than we will want. So that's something of concern, and it's affecting you. So we're gonna try and calm down a little bit. I know it's difficult when we are under stress and our mind is traveling to those events that are happening in your life. So we're gonna do a little exercise of breathing that is gonna help oxygenate all the body, the blood flow. Okay, we're gonna breathe in and breathe out. Breathe in and breathe out. Again, breathe in and breathe out. Okay, very good. We're gonna wait a couple of minutes before we redo those tests and the other that I need to do, but I'm gonna move to something more relaxing and soothing that might help you calm down. Okay, I'm gonna check your scalp for any signs of bumps, sometimes stress likes to take a little camping trip in our body, physically, not only mentally, and especially in our necks tends to be a little bit stiff, which is what I do notice in you. Okay, yeah, it's definitely kind of locked in. So this is part of your neck. Right now I was trying to move it around like this, as it normally should be able to do, but you are in a very locked down position that it's the stress making you just keep it there. So there's a lot of pressure in this area, so I'm feeling these little bumps here that can lead into other problems that we don't want to go there. Okay, so I will send you home a relaxer that is going to help your body feel less stiff as it is right now, and I'm sure that that is going to help you sleep too. When our body is loose, when our body is not all this stiffness that we're feeling because of our mental health, let's say the stress that you're feeling, our body is like a rock. So the more you stay like that, the more it's gonna hurt and locked in. So with the relaxers that I'm gonna send you home, don't worry, those are not that strong, but it's gonna help you quite a lot. It's gonna help release the neck You do feel pain in the back, right? Lower back and upper back. Yeah, you can definitely feel it here. Okay, are you feeling a bit better? Let's check your heart again. Sounds more normal. I like that. Very good. Yeah, I would say it's a normal range. Still higher than I would like, but for your situation, we are in good numbers, okay? Very good. Gonna be checking your eyes. Okay. I'm gonna look here. Very good. Good reaction. Okay. Good. Good, good, good. Okay, we're gonna do an eye test. I want you to let me know the letters in this chart. Let's start here. Good. And the letters in this row. Very good. How about here? Okay. This one's here. Can you tell me the first letter in this row? How about here? Okay. Good. I'm gonna check your nose and your mouth. Okay. Start by your nose. We're gonna look up, please. Looks well. No signs of infection, infestation, or anything like that. Very good. Let's go with your mouth. It's gonna open wide. Good. Very good. That looks great. Okay, thank you. Now, we're gonna go with your ears. I know that that's been the main issue with you for some time. Okay? I tickle a little bit, but it's necessary. Now, when was the last time that you had an examination and cleanup? Okay. So I know the overproduction is an issue with you. Okay. Yeah. Okay, it's definitely filled up again. It's not to a point that it's rock hard as it shows in your chart, but still, you might need another cleanup in maybe a week or two. Let's see the other one. Are you in any medication for this? You're in treatment. Okay. Now, I don't see a lot of problem there. Well, it is a problem, but in your case, as with your chronic problem, it's under normal levels, so I don't worry too much until you have your next specialist visit, which will be in a week. Okay, that's good. Do you know the date? Very good. That's important to know. Now your eyes look fine. The reaction is also fine. I will do a little test. We're gonna look straight forward, please. Now the light is a bit bright. Please bear with me. I'm gonna ask you to follow it just with your eyes. Good. Good. Try not to move your neck, okay? Very good. Excellent, thank you. Now, I would like you to stand up, please. You're gonna try to stand in just one leg. The other one you're gonna make a forward, as you can see with me. Let's check your balance. I've seen in your chart that your problem with your ears tends to affect your balance sometimes. Okay, let's do the same with the other leg, please. It takes a lot of effort for you. Okay, it's normal. The problem that you have with your ears is completely understandable that you have these issues. Okay, so let's try to do a little walkout like this in place. You're gonna do it for a bit. I want to see how you breathe while you're doing exercise. If you can chat with me, you can try to tell me a joke, or how was your day? I want to see your reaction when you're talking and you're walking. My day was fine, thank you. A little bit busy, but great. Really? I know how it can be, right? But that's life. Okay, you're doing great. Let's continue. You can tell me about your cat, your dog, whatever. Just want to see your reaction and how you're breathing. Okay, please continue talking. Okay, good. Continue. Very good, thank you. You know, I noticed something. Oh, you can take a seat now. You can relax. What I noticed here is while you were doing exercise, your face kind of light up. Let's remember that exercise is one of the main sources of dopamine that our body can get. So I don't know if in the line of work that you do, or maybe a bit too sedentary, that you spend most of your day in the chair. So I would suggest you, along with the relaxers that you're gonna take home, is to try to walk around during the day. I'm not telling you to go for a run or anything like that. If you can, it will be amazing. But let's walk a little bit. I don't know if you have a pedometer, or maybe in your phone you can download an app that counts your steps. That will be great. I would like you to get to a 7,000 step per day before we see you again in your next appointment. And I'm sure that is not gonna solve the issues around what is stressing you, but it's gonna help your body. It's gonna help oxygenate all your blood vessels, so it's gonna help making you feel better. And along with the relaxers, you're gonna be able to sleep. So that is gonna remove the headaches that you might experience and that overall sensation of tiredness. Okay? So I'm gonna order the prescription for the relaxers and also for walking. That is doctor's orders this time. At least I would like Let's set a minimum of 6,000 steps. Normally, a sedentary person will do around 3,000 to 4,000 steps, especially if they work from home. A person in an office that maybe takes longer could be around 6,000 to 7,000 steps. A person that is more active, around 10,000 steps average. So for you, we're gonna go first with 6,000 steps minimum, okay? And if you notice that your average is around that without making any changes, let's go high. Let's say 2,000 steps more. Okay, so if your average is 6,000 steps, you're gonna notice the first day your average without trying to do anything different. You're gonna do your whole day as you normally do, and you're gonna see your app. Oh, I took 5,000, 6,000 steps. Okay, you're gonna go higher, 2,000 more. Okay, I'm gonna put the instructions here in the prescription for you. Okay. So overall, things look good. The only issue that I'm worried about is the stress, how your body is managing it. And I'm sure with this prescription that I'm sending you, the brisk walk that I'm prescribing you, if you can go for a walk at the evenings, that will be amazing too, if you have the time. But if you can only just do the steps at home or the office, whatever, it's gonna help you too. Okay? Do you have any questions? Okay, so here my assistant is gonna give you the prescription and all the information needed. Okay, and I will see you in our next appointment. Of course, please take care. Hope everything goes well. Bye bye.